Thanks, Brandis. Approximately 1 in 3 high school students experienced poor mental health during the COVID-19 pandemic, and the prevalence of poor mental health was highest among gay, lesbian, or bisexual students. That's according to new CDC data examining how high schoolers have been affected by the pandemic. On top of COVID-related stressors, an onslaught of anti-LGBTQ laws across the country are taking a toll on young people's mental health. And joining us now with more are Lola Wong, therapist and owner of Fig Tree Counseling, and Iggy Ladden, the founder and director of the Chicago Therapy Collective. Welcome both of you to Chicago tonight. So I want to look at some graphics from the CDC. So according to that agency, 5% of heterosexual students attempted suicide compared to 26% for gay, lesbian, and bisexual students, and then other or questioning 16.5% as attempting suicide. Iggy Ladden, what do you make of this data?
It's really scary and sad to hear about what's going on, not just for LGBTQ youth, but youth across the board are reporting increases in suicidal thoughts. 20% of non-LGBTQ youth are seriously contemplating suicide, and 44% of LGBTQ youth are reporting serious thoughts of suicide. Anxiety, depression, complex PTSD are all overwhelming high school students, especially LGBTQ youth at this time.
Shocking numbers. Lola, talk about the impact of the pandemic on youth in general, and lesbian, gay, bisexual, but then also LGBTQ youth of color, how it's impacting all those communities.
LGBTQ youth of color, they face very unique stressors. For example, in the past 2 years, we've seen hate crimes against Asian and Black people rose sharply in the US. With our clients from our direct clinical work, we see that Black LGBTQ clients, especially youth, they are significantly more likely to associate racism and gun violence as their major stress, while their white peers are more likely to say transphobia or anti-LGBT hate crime. Another example is Asian American individuals are more likely to underuse mental health services, which resulted in a lot of AAPI youth. They don't have access to affirming counseling service. We also need to consider the nuances of intersectionality, like a youth of color with undocumented family struggle with stability. They may face really different situation compared to their white, cis, middle class peers. And these are all the factors affecting their mental health symptoms, support system, and also access to mental health. We also need to consider the racism from within the LGBT community. When we're talking with a youth of color and they're trying to come out, their narrative might be very different from their white peers.
Iggy Ladden, you mentioned that across the board, suicide rates and those thinking about suicide have gone up during the pandemic. Is it just the isolation of the pandemic? Is it the stress? Is it social media? Is it all of those things?
Yeah, I'd say all of the above. Social isolation might be highest in terms of COVID-related factors. That really has impacted youth across the board. And research has found that the more socially connected youth are in general, LGBTQ youth are in general, the more resilient they are in the face of all of these stress factors. Add to that for the LGBTQ community and the trans community, especially community members of color, our political climate. And you have an overwhelming amount of stress that we're placing on LGBTQ youth and LGBTQ youth of color. The Trevor Project found that 95% of surveyed LGBTQ youth found that listening to political debate in this time was hurting their mental health.
And speaking of that political, I'm sorry. Yeah, I was going to say, speaking of that political environment, Lola Wang, we mentioned the bills that are being considered or passed in states targeting trans youth and gender-affirming care. What is the impact on trans youth of these bills?
First of all, there are actual barriers that has been set up. For example, a lot of youth, they don't have access to trans-affirming care, which is not just trans-affirming, it is life-saving care. In addition to that, some bills also prevented use their coping skills. For example, for some youth, they like to play sports, and there are bills that prevent them to play sports because of their gender identity. And for youth, they're also subject to external environment. For example, when you're seeing those bills, it's not only for the LGBTQ youth, it's also for their friends, for their teachers. So that could potentially cause more bullying. And internally, we are all coping with a rapid changing pandemic world, which is a lot of insecurities and changes. And all of us, our mental health is fragile. For LGBTQ youth, that's even worse because for them, they're no longer in a safe environment. They was never in a safe environment, and now we're seeing that it's getting worse. And we're working with clients when they're struggling with fear and anxiety. We always ask them, is this fear justified? Unfortunately, during the past years, we've seen a lot of that is indeed justified, and a lot of the work we're doing is trying to accept things and then trying to gradually make changes on a more macro level.
And Iggy Ladden, some of these bills, they're targeting gender-affirming care, especially among trans youth. Can you just talk about what goes into the decision and how difficult that is for trans youth that go forward with gender-affirming care?
I think it just makes the whole climate of trusting oneself, one's body, that much scarier. It already is a very courageous thing to do as a trans person to say, I am trans and I want to live my life authentically. And hearing that, one's provider might be attacked, one's parents might be criminalized, and that oneself might be related to as mentally unwell just for being trans just makes it that much harder to take that courageous step and start living one's life in the most authentic and healthy way possible for them.
Lola Wang, we only have 30 seconds left, but quickly, how should parents be talking to their kids about this?
You don't want to hide what's happening, so you can talk about the current event in an age-appropriate way. You should validate their worries. At the same time, try not to let your own worries and fear to affect them. What's important is to talk with them. There are a lot of things out of control, but what are some of the things that we can control? For example, in this family, what are some of the concrete things that we can do to help you gain some kind of safety? Like we can use the right pronouns. We can also educate our family. We can educate the school, the educators. There are still a lot of things we can do, and that is important to focus on.
All right, a lot to think about. And our thanks to Lola Wang and to Iggy Ladden. Thank you so much.